As you can see, the Wand STA is a very simple instrument. There's just a power plug in the back. Then there's a foot pedal that screws into the front. Make sure this is on very tight. The foot pedal is going to start the flow of the anesthetic, and it has other functions which I'm going to tell you about. So when we turn the instrument on by hitting the switch in the back, as you can see, some lights come on. The first light is just the power light at the bottom. The aspiration light can be turned on or off. I would suggest leaving it on all the time, even though it may not always be just to determine if the needle is in a blood vessel or not before you inject anesthetic, but also whenever you want to take the needle out of the tissue, you can go into aspiration where everything is going backwards into the system. And in the middle of aspiration, you can take the needle out of the tissue without getting any anesthetic into the patient's mouth. These allow us to adjust the sound. It can be very loud, or you can make it very, very, very soft, depending on your preferences. So we notice also that this shows us that we're in the STA mode, and it defaults to that. Now, the STA mode will just produce a flow of anesthetic, which we call the control flow, which is 1 drop every 2 seconds. So you don't have to stay on that flow rate. If you're going to do an infiltration or a mandibular block, you can go to a faster flow rate. And we do that by hitting the select button and going into what's called the normal flow rate. At the normal flow rate, we have 2 flow rates. We have that control flow of 1 drop every 2 seconds. And then we have a rapid flow, which I'm going to demonstrate to you. That would take about 50 seconds to deliver a full cartridge of anesthetic. Then we have a 3rd flow rate, which is called the turbo flow. And that is a flow rate we're going to use whenever we are going to do an intrapulpal injection where we need force and pressure. Also, we're going to show you that these lights here are called the DPS lights, and they're going to be used whenever we do a single tooth injection, an interligamentary injection, by guiding us to the proper spot to give the injection. We use what we call wand handpieces, and they're in 3 different sizes. The brown one is the one you're probably using now for infiltrations. It's a 30 gauge 1-inch needle. The blue one is the 27 gauge 1.25-inch needle, which is used for the mandibular block. And we typically use the green one most of the time. The green is a 30 gauge 1/2-inch needle. And this is what we use for the interligamentary injection, the single tooth injection. And we use it for all the palatal injections that I'm going to show you. So to open this, it says tear to open. We pull it out of the bag. And we have 3 parts to the handpiece. The first part is the cartridge holder. And this cartridge holder has a little spike that's going to pierce through the membrane on the cartridge, as I'm going to show you. Then there's a microtubing so that the instrument could be maybe 4 feet away from the patient, okay? Then we have the wand handpiece. And the wand handpiece fits into one of the cap holders on either side of the instrument. Pull it out directly and then leave it back in very lightly so you can use it. So you can use any cartridge of anesthetic that you wish, articaine, lidocaine, bupivacaine, any kind of drug you want, as long as it comes in a dental cartridge. If you're in a country that uses 2.2 milliliter cartridges, then we have an adapter that fits on the top of this instrument. So what we're going to do is pierce the membrane of the cartridge through the spike by just pressing. We place the cartridge holder on the top of the instrument. We press down, and then as a quarter turn to the left, what that is doing is this purging the air out of the tubing, and it's now filling it up with anesthetic, and we're ready to start to deliver the anesthetic. You can also see some lights come on, and these lights indicate how much anesthetic you've delivered, or indeed how much is still left in the cartridge. You don't have to actually look at that. You're going to be able to hear a sound So when you hear a sound like a gong, that tells you that you've delivered 1/4 of the cartridge. When you hear gong gong, that means you've delivered half of the cartridge. So now we're ready to start to deliver the anesthetic. So if I depress the foot pedal down, we're going to deliver the anesthetic at this control flow rate of 1 drop every 2 seconds. And like I said, this flow rate is below the patient's pain threshold. This needle could be in the sulcus, it could be in the palate of the patient, and they would not feel the delivery of the anesthetic. When we want it to stop, we go into aspiration by hitting the foot pedal all the way down and releasing, and it now is in aspiration. It's about 6 beeps. So like I said, in the middle of aspiration, we take the needle out of the tissue without getting anything in the patient's mouth. So I showed you that there was 2 speeds that we normally can use. So if I hit the select button once again and go to normal mode, you're going to see that we have 2 flow rates. So if I depress the foot pedal part way down, we enter what we call cruise control. After 3 beeps, the voice said cruise. I took my foot off the foot pedal. Now I'm in cruise control. It's going to stay at that flow rate until I tell it to stop. You don't have to have your foot on the foot pedal throughout the whole injection. So if I'm given a mandibular block, and for example, I'm going to rotate the needle back and forth till I get to the injection site, in which case then I will hit the foot pedal and go into aspiration to determine if I'm in a blood vessel. And if I'm not in a blood vessel, then I can go to the rapid flow rate. So during an infiltration or during a mandibular block, whenever we're in tissue that can expand, not dense tissue like in the palate or the sulcus of the tooth, but expandable tissue, I can go to the faster flow rate by depressing the foot pedal all the way down. You heard that gong? That told me that 1/4 of the cartridge was finished. So it's dispensing the cartridge at a very rapid flow rate. It would take about 50 seconds to deliver the full cartridge. You heard half the cartridge being finished. So when I take my foot off of the foot pedal, it goes into automatic aspiration. Okay. Now, there's some other features to this I want to talk to you about. If we're on the STA mode and going at that control flow rate, when we're doing an interligamentary or a single tooth injection, as we call it, these lights are what we call DPS lights, and they will come on to tell us that we're in the proper spot to give the injection, typically the bottom of the sulcus or the top of the periodontal ligament space. So I'm going to try and demonstrate what this would sound like on a Typodont. The lights will go from red to yellow to green. Sometimes it works. There they come on. If you see the lights come on and you hear the sound and the lights are at red or yellow, that's perfect. Hold the needle in place without putting any pressure on the needle. These lights tell us that we're in the proper spot, like a GPS, but they will not tell you if you're using too much pressure on the needle, sometimes trying to get the lights to go all the way to green. That's not what we want to do. We want to hold the needle in place with very, very little pressure. You just heard 3/4 of the cartridge being dispensed. We don't necessarily want it to go to green because that means that we're probably putting too much pressure on the needle, which will block the flow of the anesthetic and keep the anesthetic from dripping into the bone where we want it to go, which will give us satisfactory anesthesia. Whenever we see the lights come on and we hear that sound, then we just hold the needle in place. There's another feature that I want to explain to you. Let's say you want to give more than 1 cartridge, maybe for a mandibular block or maybe for some other injection. We can have something called multi-cartridge. The plunger will retract. You can take the cartridge out of the instrument, and then there's some openings in the cartridge holder that you could press the cartridge out. This is typically done by your dental assistant. And you can actually leave the needle in place. And you can then put the second cartridge in without taking the needle out of the tissue. You keep it at the injection site. Then you press this button called multi-cartridge. Now you're telling the instrument that we've already purged the air out of the tubing. We don't need to purge air out again, and it will not purge the second time. So we'll put this in, turn a quarter turn, and as you see, it did not purge the air out. This is useful for anybody that does multi-cartridge injections on the same patient, on the same injection site. This is all done by the dental assistant. It didn't take very long at all. There's just one maintenance issue here. There's a O-ring at the top of the plunger you can maybe see, and that needs to be lubricated. Every 25th time you turn the instrument on, the voice may say, check lubrication and O-ring. This is a signal to your dental assistants or your staff to check that this is lubricated properly. We give you one little tube of silicone gel with every box of handpiece that you buy. And that is what you should use to lubricate this probably every 2-3 weeks, something like that. So how do we get this plunger to come up? We turn the instrument off. Then we hit this hold to release button and turn the instrument on. The plunger comes up. We can then lubricate the O-ring. You don't have to lubricate the whole plunger, metal plunger. In fact, don't do that. Just lubricate the O-ring. And then when you're finished, you can hit that button once again, and the plunger will retract. That is the only maintenance on the instrument.